We are here this morning. Hey, it's Jody and Heather with Coffee with the Community, and we have Pam Walker with Kettering Health Network, and they have the coolest service. They have a free service that can help you find doctors. Pam, tell us a little bit about what that is.
Well, good morning to both of you, Ross, Jody, and Heather. It's so good to be with you, and thank you for inviting us on this morning. I just have the best job, and I'm so blessed and fortunate to get to do what I do. But I'm part of Kettering Health, and we have a team of three of us, all with nursing backgrounds. And what we do is we help the public find health care or anything that would impact their health. And so it's a free service, and it's hard to explain because it's so broad, but we will help anybody of all ages, regardless of whether they have insurance or not. And if they need help navigating healthcare, which can be really complicated and stressful at this day and age, we jump in and we partner with them and try to make it as stress-free as possible and find them what they need.
Yeah, I think it is really hard to find doctors. It's really hard. And sometimes you don't connect with them, and sometimes they won't take new patients. You get
Right.
recommendations from people, and then they're not taking new patients. So I actually did call Pam for myself. And so she was so
I need
amazing.
to.
Yeah, I know. She really, really listens. I will say that. I love that about you, Pam. You just you listen, and it really felt like you cared about what I needed, and really tried to find me the right person. And so I just loved that. That was nice. And she got back to me with a list of doctors, and so we just need to make an appointment. That's on me. I need to do that, Pam. So,
Yeah.
but yeah,
Right.
I just didn't even know this service existed before I met you, and I'm so happy that I met you. You're such an awesome person to be around anyway, so I love hanging out with you. Um, but um, but yeah, I didn't even know this service existed.
No, until we met you, Pam, and you're just so wonderful to share your info with us, but we had no idea. Where's the best place for people that see this and want to connect with you? What's the best way to do that?
Okay, well, typically this is all usually handled on the telephone, which is not my preference because I would much rather sit with a cup of coffee like we're doing today and just
Yes.
enjoy a cup of coffee, get to know you, and have you
Yeah.
share with me what you need. But that's not very realistic. So most of the time we're in our office and people call us. And we have a phone number, which I'll give to you at the end of our phone call or our session today. But they would call us and they would explain to us what they're looking for, and then we would shift a modes, and then we would do an intake. And I say intake, that's an official word term, but basically I would ask questions to get to know them, to know what they're looking for. And we ask a few questions like your date of birth, your insurance, where you live, and now what are you looking for? What do you need? And as you experienced, Jody, we really do try to customize and personalize this based on your needs and your personality and where you live. And maybe you've had a bad experience with a male MD, but you want to switch and try a female MD. And we honor that and understand that. And we'll do that research to try to find you the best fit. But we never limit it to one. We try to give you a list of people based on providers who are taking new patients in a reasonable amount of time in your geographical area.
Which is a
And then
lot.
we email you that. It's a lot, because we really do. Like if you live, I forget, Jody, where you're south of town, aren't you?
Yeah, we're south of town.
Yeah, so
Springboro.
you wouldn't want me to do a name of a doctor in Vandalia. That would be,
A
uh,
big guy.
that would. Also, we would customize it and send you names, and then we send you a list, and then it's your responsibility to make the decision and make your own appointment.
Yeah. So how did you get into this, Pam? How did you get
Uh,
how did you land where you landed with the perfect job?
Well, I would give God all the credit for that.
Yes.
My faith is really important to me. I've been part of Kettering Health since 1970, which has been eons ago. And I started there as a new graduate from UD with a degree in psychology, and realized it wasn't sufficient, didn't give me enough opportunity to get involved with patients. So went back and got my nursing degree, and I've been in and out of Kettering ever since. So several years ago, I was a door screener during COVID for Kettering. I was working there in a small department called Community Outreach. And lo and behold, they posted this position for a healthcare navigator. And you may not know this about me, but I've been helping people connect for decades because that's just who I am. I just love to help people. And when I meet a new friend, I will listen and learn what they do and what their background is, but I store it away because that information may be helpful for somebody in the future.
Yeah.
And so when they posted this job, I really felt that God had posted it for me. So I applied and I was hired, fortunately. And so I'm one of 3. And so we started this 3 years ago in January of 2022.
So Kettering
we're almost
didn't have it before. That was a new program for them.
A brand new program. In fact, when we started our program, we had to create it from the ground up. And we looked for another model in Ohio, in Dayton, first of all, and then we expanded it to Ohio. And then we did a national search and we could not find any program similar to what we offer. So we really had to just intuitively figure out who we were going to serve and how we were going to promote it, and then the services we were going to offer.
Yeah, that's crazy that there isn't that service. I mean, when you stood up the first time when I met you and you said what it was, I'm like, that is brilliant. Like, that is brilliant because, we have people that move into town that don't have doctors at all, right? My OB's retiring this year. I'm probably going to cry because I loved him so much, but now I'm going to have to go find somebody new and I don't know where to go with that, so there's all kinds of people. I know Pam can help me with that. But before I didn't, I wouldn't have known, where to go with that. So there's all kinds of reasons, either some people, just, they don't go to the doctor very much because they don't know who to go to. And they end up, doing the minute clinic and all of those kind of things. So there's so many options of people that can help you, or they're ready to move on to, a different phase, or they need a specialist. There's so many ways that I think you can help people. And so I'm so, I hope that y'all, can use this service because I really think it's really, really helpful.
Yeah. And Pam,
well, you bring up a good point. Pardon me?
And say your heart for helping people is apparent every time we talk to you. So to extend that out to the public with this service, I think it's amazing that our area has this because it is stressful and overwhelming when you need that care.
Right. Well, we are blessed that Kettering had the foresight to develop this and then to give us the freedom to go out and develop it and to see who could use our services. And we've helped all ages. We've helped infants, parents with infants, and I think our oldest client was in her 90s. And we helped her as well. But you never know who's going to need our services. For example, I moved to Bethany myself in January, and so I'm getting to know the residents. And I hosted an open house at my cottage on Sunday for everybody who lives on my street. So we had about 20 people who came, including a new couple who is still in the process of getting ready to move here from Columbus. And she was sitting at the table just chatting with all of us. And she said, well, my biggest stressor is trying to find doctors for this area. And enough people at the table know what I do. And so they started laughing and they said, well, you're just sitting next to the right person who can help you. Yeah. And so sure, on Sunday afternoon, I took all of her information. And then I called her Monday morning, and she's still in Columbus. And I found everything she needed. And we sent her a list of doctors yesterday morning so that she can get started and try to get on a list before she moves here.
I just can't tell you how much stress that relieves, really, because you need a doctor that's going to listen and talk to you and do all the things, and you just don't know which ones of those are. You just don't know.
Well, and that's really hard because we have, and I don't know whether this is a national issue or not, but in Dayton, we have more patients than we have physicians because we don't have enough MDs and osteopaths to serve the Dayton area. And many of them are not taking new patients. And if they are, it's a 2 to 4 month wait. And that's so stressful for people when they get on the website or get on the phone and try to find one and they don't know who to trust, and they get frustrated and they quit. So they end up going to the emergency room, which is an extra expense for them. because they don't know where else to go.
Well, and I don't think the emergency room is the best path. I mean, the emergency room wants to, fix whatever that problem, immediate is and move on because that is their job. They're there for emergencies, not holistic health of like you go and you see a doctor. And so I think
Right.
that's important too.
And it costs more money, and they're exposed to other illnesses in the waiting room and they're waiting to see a doctor. And it can take hours to get into an emergency physician because they're seeing people who have more urgent healthcare needs. So,
Right.
Again, but if somebody's sick and they don't have a doctor, they don't know where to go. I understand why they go wherever they have to.
Well, yes, yeah, me too. I just think
Right.
service is a brilliant plan, and I think Kettering Health was, really smart to put it together.
Mhm.
What do you wish that that the community knew? What do you wish that more people knew about your service?
Well, there's several things that they don't realize. First of all, we're totally free
Yeah.
and there's no gimmick. They really say, what's the catch? There is no catch. Secondly, probably half of the referrals that we make are for people who are not part of Kettering Health, meaning you don't have to be a current patient within Kettering Health. And if you're asking for a resource like a dentist or transportation or a counselor, that may not and probably isn't part of our Kettering Health network. So we will go outside of the network to help them find whatever they need. So it doesn't have to be a Kettering Health physician or provider, because so many different aspects of our life impact our health. For example, dental work. Probably our third most requested phone call is to find an emergency dentist because somebody has not been to a dentist for years and they've neglected their teeth, which they can do for a while, but eventually it catches up with them. And then they have a roaring infection, which can be dangerous because people don't realize that infection can travel to the brain, and they need somebody today.
Yeah.
And so I wish people understood how vital dental care is
Mm-hmm.
and didn't wait until the last minute. So that would be another thing. And another is that they don't have to have insurance to use our services because we have a list of providers who will see people who are on Medicaid, who have no insurance, and we'll do whatever we have to try to help them find what they need based on insurance or no insurance.
That's amazing. I heard you say transportation too, so it's not just a physician.
No, I mean, because a lot of people have transportation issues and that has surfaced. And so we are now, Kettering Health is engaging in a symposium, I guess you might want to call it, with other providers in the greater Dayton area. And we're all brainstorming together as a team. So Care Sources there, Premier's there, Kettering's there, and we're all trying to figure out how can we meet the transportation needs for those who don't have reliable transportation. Because unfortunately, if somebody uses, say, Uber, and Uber doesn't come to get them on time and they show up at the doctor's office frequently late, the doctor's office will discharge them and inactivate them as a patient. So they end up having no health care, and it's not their fault. It's because transportation was unreliable. So we are brainstorming on how we might be able to better meet the transportation needs of patients in the greater Dayton area, not just from Kettering Health, but from a broader perspective.
I love that, working together for the community, because the need is so big and so many things layer on top of each other to make healthcare hard, like the transportation and the lack of insurance and all of that. So I just love everything that you do.
What's your favorite part of your job?
Wow. I mean, I love my job. I can't believe I get paid to do this. I'm so grateful that God has orchestrated all this for me. I think we get routine phone calls of people who are switching and need help. And of course, that's gratifying to help them. But the most gratifying is when somebody really is desperate and doesn't know where to turn. And I'll give you a case, an example. 2 years ago, I was, again, I never know when I'm going to meet somebody who needs our help, but I was getting my car change, the oil change in my car. And I was sitting in the lobby of the service station waiting for them to do that. And a woman walked in that I knew. I I could tell she was stressed. I gave her a hug and I said, "Is everything okay?" And she said, "No, it's not." Our son, we've just discovered, has multiple substance abuse addictions, and we have no idea where to turn.
Mhm.
And today is the day that we're dedicated to trying to find help. Well, as it would be, I had a similar situation with a family member who had a few years ago, had similar addiction issues, and he ended up having a cardiac arrest because of his addiction. He was trying to get off of his addiction, and so my family learned about some wonderful resources. So I was able to connect this mom with an independent intervention specialist in Cincinnati who helped their family for the next 2 years. And they sent her son to an inpatient program in Cincinnati, which was not successful, and he relapsed. So they got back in touch with the resource we sent her to, and they found a program in Utah that specialized in substance abuse issues for younger adults. And he went to Utah, and he's free of substances now, and he has a job, and that mom and I send prayer requests regularly. And that's so gratifying, because whenever I see her, I know that her son is doing well. It may be in Utah. It was not with the Kettering Health service or support program, but we were able to connect her. And so there's so many stories like that, but that's just an example of how gratifying it is to reach out and help somebody who has no idea where to turn, but God uses us.
I think that's exactly true. What you just said is that God uses you, because all of your stories that you've told me so far, it feels like, oh, and I just happened to be talking to this person who needed exactly what I am. And that isn't an accident, Pam. That's
Right.
not an accident. That's, that's amazing. That's amazing. And I know that you put that out into the world, and that's what comes back to you. And we're lucky to know you. So.
When I'm going to meet somebody who needs more than a physician or more than healthcare, but it all impacts our health and our well-being. So thank you for being there for us.
Oh yeah, I love that about our group of people that we have found, is that, sometimes what people need isn't what I have, but if I'm lucky enough to know the person that is what they need, I just love sharing and connecting the people. I love that.
Right.
Right?
So
So
glad. So
yeah, we just want to help them in whatever way they need it, right?
thank you. Thank
All
you.
right.
Would you like me to give you information on how people can find us?
Yes,
Yes,
please.
please.
Okay, so as I said, I'm with the team at Kettering Health, and we're located in Beaver Creek, but that's not important because you can find us on the telephone. And our number is 937-558-3925. Let me give that again to the people who are looking for a pen. 937-558-3925. And we're available Monday through Friday, 8 to 4:30. Just leave a voicemail if we're on the phone with somebody else, and we'll get back to you. And we typically do the research and get you the information the same day that you call.
Yeah, it was a great, when I talked to you, Pam, like I said, I felt like you were really listening to what I needed. And the next day I got a list of doctors, and it was very comprehensive, and I really appreciated that. And I also felt like if I needed something else or needed to come back, you were there to help if I need that. So it felt very good.
Thank
It felt very good to have that, to talk to you about it. So thank you so much.
See, what you both don't realize. Yeah, what you don't realize is you're both sort of unofficially on our marketing team.
Right. We all are together, right?
Yes, we just love
Yeah.
this community. So yeah.
Yeah, because we need you to tell people that we exist. Yeah.
And we will. We do.
Yeah.
We definitely do.
Thank
Yeah, because
you.
I just it's not something I would have looked for, because it's not something I even thought would
Right.
exist. So I wouldn't even have Googled that. Like, where's my free service to find my doctor? Like, I would not have looked for that. So
Yeah.
yeah, pretty awesome.
Yes, absolutely. I love that we met you and that we can share what you do, because it's amazing.
Thank you. Thank you so much. Well, last year we helped almost 1,000 people. So the
Ah.
word's getting out, but we can handle a lot more. So please tell everybody and use our service.
Yep. If you need a doctor, call Pam. She
Yep.
can help you. So thanks
Okay.
for talking to us today, Pam.